Introduction: a fragile web of memory. Unraveling the complexity of cognitive decline. Memory is like a fragile web. Each strand symbolizes an essential aspect of brain function. When multiple strands weaken, the web unravels, leading to memory loss and cognitive difficulties. Aging adds complexity to this process, as the decline is rarely caused by one single factor. Instead, a combination of elements, like medications, metabolic imbalances, and even emotional health, work together, subtly affecting brain function over time. The real challenge lies in understanding the nuances. Is memory loss due to reversible issues, such as a medication side effect, or an irreversible condition like Alzheimer's? This distinction is critical. Many cognitive challenges that seem irreversible can improve when the right medical intervention is applied early. This video is designed to provide a comprehensive guide to the 10 most common causes of memory decline and how recognizing these factors can transform care for your loved ones. Let's embark on this exploration together, breaking down the complexity of cognitive decline and discovering how small actions and informed decisions can help older adults maintain their cognitive health for as long as possible. Understanding the complexity of memory loss. Memory decline is rarely caused by a single factor. Think of memory as a delicate web where every strand represents a part of brain function. If multiple strands weaken, the entire structure can become unstable, resulting in cognitive impairment. Medications, hormonal changes, emotional health, and even infections can all play interconnected roles in this decline. Let's explore the 10 most common causes of memory loss and how they impact cognitive health in older adults. The 10 causes of memory loss and cognitive decline. 1. Medication side effects. Medications are a leading cause of cognitive problems in older adults. Some over-the-counter, OTC medications, such as Benadryl, Tylenol PM, and NyQuil, contain anticholinergic substances. These substances block neurotransmitters essential for brain function, leading to memory issues. Many older adults unknowingly take these medications for allergies, sleep, or anxiety without understanding their potential side effects. The effects can be severe, resulting in confusion, poor concentration, and even hallucinations. Example: Mr. Nguyen, 82, started taking NyQuil every night to help with sleep. His family noticed a decline in his conversation abilities, mistaking it for early dementia. Once his doctor identified NyQuil as the culprit and discontinued it, his memory and clarity improved significantly. Advice for caregivers: review all medications your loved ones take, even OTC drugs, and consult with a physician. Reducing or stopping certain medications can improve cognitive performance. 2. Metabolic imbalances. Brain function depends on a stable balance of electrolytes and metabolic components in the blood. If sodium, calcium, or glucose levels become too high or too low, the brain can't function properly. Liver or kidney dysfunction can also allow toxins to build up, further impairing cognition. Personal thought routine. Blood tests are crucial for elderly adults. An undiagnosed imbalance in blood chemistry can result in profound cognitive decline. Fortunately, most of these imbalances can be easily treated once detected. 3. Hormonal changes. Hormones regulate many bodily functions, including brain health. A common culprit of memory problems in older adults is a decline in thyroid hormone levels. While hormonal imbalances like those involving estrogen or testosterone occur more often in midlife, thyroid dysfunction can affect brain function at any age. Advice for families. If your loved one experiences unexplained memory issues, request a thyroid function test from their doctor. Treating thyroid-related problems often improves cognitive symptoms. 4. Vitamin deficiencies. Among all vitamins, B12 plays a critical role in cognitive health. A deficiency can cause significant memory loss, confusion, and even mood changes. Though vitamin D has been widely discussed for its potential benefits, studies show that supplementing with vitamin D has limited effect on cognitive improvement. Practical tip: encourage elderly family members to include foods rich in B vitamins in their diet, such as fish, eggs, and dairy. Regular checkups can also help detect deficiencies early. 5. Delirium. Delirium is a sudden, temporary state of confusion, often triggered by hospitalization, surgery, or illness. Unlike dementia, which develops gradually, delirium can appear suddenly and cause dramatic changes in behavior. Example: Mrs. Hoa underwent hip surgery and soon began experiencing severe confusion. Her family worried it was dementia, but over several months, her mental clarity returned as her body recovered from the stress of surgery. Takeaway: if your loved one shows sudden cognitive changes following an illness or hospitalization, ask their healthcare provider about delirium. Recovery may take time, but early detection helps prevent complications. 6. Psychiatric illnesses. Mental health conditions such as depression and anxiety can impair memory and concentration. In some cases, older adults develop psychotic depression, where delusions and severe cognitive issues emerge alongside mood disturbances. Advice for caregivers: pay attention to mood changes. Depression is often mistaken for dementia in older adults. Treating the underlying mental health condition can lead to significant improvements in memory. 7. Substance abuse or withdrawal. Substance abuse, particularly alcohol and sedatives, can cause long-term cognitive issues. Even if the individual stops using the substance, withdrawal symptoms can temporarily worsen memory and thinking problems. Example: Mr. Lamb, a 70-year-old retiree, consumed alcohol daily. After cutting back on drinking, he experienced confusion and anxiety due to withdrawal, which affected his cognitive abilities. With medical support, his brain function gradually improved. Recommendation: monitor your loved one's substance use, even if it involves prescription medications. Proper medical guidance is essential to manage withdrawal safely. 8. Brain injury and vascular damage. Injuries to the brain, especially vascular damage, can result in memory problems. Strokes, whether large or small, impair the flow of oxygen to the brain, damaging cells over time. Even minor strokes may not show obvious symptoms initially, but can have cumulative effects on cognitive health. Insight: keep an eye on cardiovascular health, as factors like high blood pressure, diabetes, and smoking increase the risk of vascular brain damage. A healthy lifestyle helps protect both the heart and brain. 9. Neurodegenerative diseases. Conditions like Alzheimer's, Parkinson's, and Lewy body dementia cause progressive damage to brain cells. These diseases develop slowly, often taking years to manifest noticeable symptoms. Example: Mr. John was diagnosed with mild cognitive impairment, MCI, a condition that often precedes Alzheimer's. While there is no cure, his doctors implemented lifestyle changes that slowed the progression of his symptoms. Advice for families: early intervention can improve quality of life. Engage your loved one in mentally stimulating activities to help slow cognitive decline. 10. Infections and toxins. Acute infections, such as pneumonia or urinary tract infections, UTIs, can trigger sudden confusion. In some cases, environmental toxins like heavy metals or pesticides can contribute to cognitive decline, although this is less common. Advice for caregivers: if your loved one develops sudden memory issues, check for signs of infection. Early treatment can restore cognitive clarity. The decline of memory is often viewed as an inevitable part of growing old. However, with the right knowledge and proactive care, many causes of cognitive problems can be identified, treated, and even reversed. Memory loss doesn't have to mean the end of independence or the loss of quality of life. By addressing issues like medication side effects, metabolic imbalances, mental health conditions, and brain injuries, families can play a vital role in helping their loved ones preserve their mental sharpness. Here's the most important takeaway: don't wait. If you've noticed cognitive changes, whether subtle or dramatic, early intervention matters. Each small effort, from regular health checkups to monitoring medications and emotional well-being, can significantly affect the brain's ability to function well over time. Remember, aging doesn't have to mean losing oneself to memory decline. Equipped with the right tools and strategies, families can help their loved ones maintain mental clarity, emotional balance, and a sense of purpose well into their later years. Stay curious, stay proactive, and work closely with healthcare professionals. You have the power to make a meaningful difference. Thank you for joining us on this journey. Let's continue to foster awareness, compassion, and action to ensure that our elders live their best lives. Because memory, after all, is worth preserving.